A fake YouTube chef cut his hand in the kitchen. This is what happened to his wallet. KB is a 25-ish year old YouTuber presenting to the emergency room, which was a huge financial mistake. This video was brought to you by CuriosityStream. My original plan for this video was to take that scenario through multiple different healthcare paths to show you all the options and costs. I very quickly realized that wasn't going to work. Even if I had done that, those numbers would have been completely useless to you because of how healthcare works in our country. It's not like ordering a Big Mac. The numbers I would have given you would have only applied to other 25-ish year old men living in it's very unlikely that it would have been relevant to you. So there's really no point in digging up those numbers, especially because the cost of a procedure not only varies within the same city, but sometimes on the same block. A few stitches can cost anywhere from $200 to $3,000. I pick stitches because it's fairly universal. There is no gender or race or even class that's more prone to needing stitches. I've personally needed stitches at least 5 times that I can remember. The obvious explanation for that wide range is where on your body were you injured? Stitches on your shin are going to be easier and cheaper than stitches on your eye. Except no, some people pay less for eye stitches. And these price ranges exist across the board for all procedures. If you walk into a medical facility with a burst appendix, it's going to cost you anywhere from $1,500 to $180,000. I somehow doubt that one appendectomy could be 120 times better than another. Some cases are complicated and require extra imaging or post-operative care. The point is, you don't know that beforehand. When you get the bill, it could be anywhere within that range. So rather than just shouting numbers at you and laughing at how ridiculous things cost, I want to explain why the range exists. Many of you likely know parts of the answer already. The most obvious being that urgent care is almost always cheaper than emergency care, both with and without insurance. Urgent cares are a relatively new concept in the US and offer a cheaper alternative for non-life-threatening emergencies, like stitches. Let me be clear, when in doubt, go to the emergency room. You'll never be turned away. But if you go to an urgent care with something more serious, they might send you to the ER, possibly delaying life-saving treatment. But odds are, if you only need a few stitches, it's not going to kill you anytime soon. Emergency rooms cost so much more because of the infrastructure and overhead required to keep a large hospital running, but also because of more nefarious reasons. 70% of hospitals in the United States are privately operated but not run for profit, which is surprising to most Americans. Insurance companies, on the other hand, are only run for profit. So in order to attract more customers, insurance companies have to offer better deals, which is somewhat difficult when a hospital is run not for profit. Usually, if you're not making a profit, it's because your prices are already as low as they can be. Enter the hospital Chargemaster.
That's not a Chargemaster.
Pretend. Every hospital in America has a list of goods and services they provide, which until this year was kept hidden from the public, which is a huge problem in a capitalist system. You can't make an informed economic decision if there is no price transparency or easy way to compare costs. Not that you would ever shop around in an emergency anyway. So the insurance companies went to the hospitals. Side note, in some cases the insurance companies own the hospital outright, and while the hospital is nonprofit, they're not. And said, hey, you're currently charging your customers $200 for this service. Why don't you increase your Chargemaster price to $250, but still only charge our customers $200? That way we can tell them we're getting them a discount. This should sound familiar to any of you who have ever shopped on Black Friday. Repeat that for every procedure and medication nationwide, and you have the first piece of the puzzle. When figuring out the cost of healthcare in the US, you have to look at multiple variables. We'll add to this list as we go, but we can start with the base cost. The price of materials, labor, facilities, and sometimes including those blue light Chargemaster rollbacks. As we've seen, this base cost can range from 3 to 6 digits depending on where you go, which is the second variable. Location. Not only are we talking about state or city, but street. Add in provider type, are you going to an emergency room, urgent care, or just your doctor, and you have even more variation. Since we're only 5 minutes in, you've probably figured out that this list isn't even close to complete. An unfortunate reality of our system is that it also matters who you are. The Affordable Care Act made it illegal for hospitals and insurance companies to charge you differently based on your previous medical history, but they can still charge you differently for basically any other reason, including gender and perhaps most obviously, your age. For example, stitches on an infant are objectively more difficult and therefore more expensive. Bet that wasn't the direction you expected me to take the ageism argument. Procedures aside, age is one of the biggest factors that contribute to the cost of health insurance. All right, non-Americans, get your laughs out of the way now. Health insurance started off as a sort of membership program known as health assurance. You paid a fixed amount every month and any medical costs you incur were on them. Your health was assured. It didn't take them very long to figure out the formula for success. Obvious abuses aside, that simple model just wasn't sustainable. So over time, they've shifted more of the cost of actually using medical services onto the consumer, called it insurance, and made it so confusing that most Americans don't even bother trying to understand it. Lucky for you, I'm not doing anything. I've got time. The health insurance industry didn't really take off until World War II. Along with rationing fuel and rubber, prices and wages were also fixed by the government. So companies had to get creative to attract talent. The most popular way was to offer benefits on top of your salary, like paid vacation, housing, or health insurance. Today, 60% of Americans get their health insurance through their employer. This is thanks in part to ObamaCare, officially known as the Affordable Care Act, or ACA, which made it so that any company with at least 50 employees has to offer health insurance. Though offer is a bit of a loose term, which is yet another factor, how much your employer offers to contribute. Your insurance premium might be $500 a month, but your employer might only pay half of it, or none of it. In order to discuss how insurance actually works, let's take a look at something more simple. Car insurance. In most states, if you own a car, you are required to have car insurance. The more people are paying into insurance, the lower the cost for everyone. Most people accept this reality when it comes to car insurance, but not health insurance for some reason. The Affordable Care Act did a lot of good things, like mostly getting rid of pre-existing conditions or allowing you to stay on your parents' insurance until you're 26, and a bunch of other stuff we'll get to later. But it also required everyone to have insurance through the individual mandate, the hope being that the more people who have insurance, the cheaper it will be for everyone. Just like car insurance. But the mandate was repealed, so never mind, I guess. Everyone with insurance pays a premium. This is like your membership fee, and you pay this regardless of whether or not you actually use it. If your premium is $100 a month and you never get into an accident, that $1,200 a year is simply gone. Because of this, a lot of people view insurance as a bit of a scam. If I didn't use it, I should get it back or something. This is what I'm going to call stage 0. You pay your premiums, you don't use it, and nothing happens. Rinse and repeat every year. There are 2 tiers of car insurance, the lowest being liability, which only pays out if you're at fault in an accident, and comprehensive, which pays for any damage to your vehicle, whether it be a collision or an act of God. But once you actually have an accident, you enter stage 1, when you pay all costs out of pocket until you reach your deductible. This is the amount you have to pay before your insurance will contribute. For many car insurance plans, the deductible is also your maximum out of pocket, or MOOP.
Who the hell is MOOP?
It's the most you will ever pay to fix your car in a given year, after which you enter stage 2, when your insurance pays all remaining costs. Sometimes there's a maximum annual or lifetime benefit, after which you would be on the hook for any remaining costs, but that's fairly rare. So if you got into an accident that cost $15,000, you would pay up to your deductible, say
$500,
and your insurance company would cover the rest. Congratulations, having car insurance probably saved you thousands of dollars. But when it comes to health insurance, people only focus on the cost. If they never go to the doctor, they're just throwing away money every month. This is important, so pay attention. Not having health insurance is only cheaper if you know that your healthcare costs without insurance will be less than your annual premiums and your deductible put together. Remember, without insurance, you will be paying the regular Chargemaster prices. Some hospitals might be willing to work with you and give you that discount price if you're uninsured, but you can never count on that. For our car insurance example, that tipping point would be $1,700. If you know that your car repair costs are going to be under $1,700, it's cheaper to go without insurance. But you literally can't know that. You can't predict if some random tire is going to hit you, just as you can't predict if you're going to cut yourself yourself or your appendix is going to burst. So let's say you're playing it safe. You have health insurance and something unpredictable happens. Just like car insurance, you started in stage 0. You've been paying your premiums and have been relatively healthy until now. You go to the hospital and you enter stage 1. You are paying everything out of pocket up to your deductible. So far, everything is pretty simple. But stage 2 is where things become a bit more complicated. This is when you and the insurance company split the costs of your care through 2 mechanisms. A copay is a flat fee, like $25 every time you go to the doctor. That's just to walk in the door, by the way. If they do anything more than that, it costs extra. Usually through coinsurance, which is a percentage rather than a flat fee. So for example, 20% of all outpatient procedures. Only copays and coinsurance count towards your MOOP. Premiums, prescriptions, and out-of-network costs do not. Once you hit your maximum, you enter stage 3, when your insurance company covers all remaining costs. The Affordable Care Act prohibits any maximum annual benefit or lifetime limits for health insurance, though they can still exist for dental and other insurance types. So stage 3 has no maximum dollar amount, but your MOOP is an annual number that resets each year. This is the next variable we're going to add to our list: when the healthcare cost occurs. If your appendix bursts with only 1 month left to go in the year and you hit your maximum out of pocket, if you need continuing care next month, which is also technically the next year, you have to pay your maximum out of pocket again, effectively doubling the cost of this single event even with insurance. There are many different types of health insurance programs, all of which cost different amounts based on what type of care you want, or more likely what your employer chose for you. The cheapest type is an HMO or health maintenance organization, which operates through smaller networks of providers. Another very important term and concept. Doctors and hospitals sign agreements with insurance companies to be part of their network and see their patients, sometimes at a reduced rate, as I mentioned earlier. If you're on that insurance, you can only see those doctors and hospitals. If the doctor or insurance company decide they don't want to work together anymore, you don't get a say.
If you like your doctor or healthcare plan, you can keep it.
He couldn't legally mandate that your doctor and insurance company work together forever. This is America. So now your doctor is out of network. If you see a doctor out of network, you will very likely be stuck with the entire non-discounted bill. And you might not know it until afterwards. It's not uncommon to go to an in-network hospital and be seen by a prohibitively expensive out-of-network specialist at that hospital. HMOs typically have lower premiums up front, but higher out-of-pocket expenses later. Everything is routed through your primary care provider. They make decisions about your health, and you can't see a specialist without a referral or pre-authorization from the insurance company. Your doctor acts as a gatekeeper for your healthcare, which would make the insurance company the keymaster? The other end of the spectrum is a PPO, or preferred provider organization, where you don't have a primary care provider deciding what specialist you see or what care you receive. The premiums are higher, but the out-of-pocket expenses are lower. They typically have a larger network than HMOs, and out-of-network care is significantly cheaper. You don't need a referral or pre-authorization. So it costs more to have more control and more choice in your healthcare. That's how capitalism works, right? The more choice and competition you have, the higher the... And then you have all sorts of programs in between, like the exclusive provider or EPO, which is similar to a PPO, but out-of-network costs more and you might need pre-authorization to see a specialist. Then there's point of service, which is like an HMO, but out-of-network costs less and nobody abbreviates it. It's a mess, and even the definitions I just gave you vary from company to company and state to state. But in general, those are your options. Yet another variable to add to the list. But wouldn't it be great if we could just cut out the middleman and pay for our own healthcare?
Yeah, or you could.
Shut up, this is America. Some people have the option of getting a high deductible health plan, or HDHP, which have extremely low premiums and extremely high out-of-pocket costs. But it unlocks the ability to open a health savings account. An HSA is very similar to an IRA retirement account. Any money you put into it is tax-free, and as long as you only use it to pay for your insane healthcare costs, it doesn't get taxed on the back end either. But wait, it gets better. Just like an IRA, you can invest your HSA money, growing it potentially infinitely, which you also don't have to pay any taxes on. This is why they call them triple tax shelters. If you're like me, you're already Googling how you can open one of these up, and I've got some bad news for you. You can only open an HSA if you have an HDHP. If you have any other form of insurance or even no insurance, this option is not available to you. And unless you're perfectly healthy, that's probably a good thing. The astute amongst you will have noticed that I haven't given you any numbers for any of these programs. And there's a reason for that. Not all HMOs or PPOs are created equal. Another good thing the Affordable Care Act did was establish a standardized tier system for health insurance, so people looking on the marketplace can price compare and shop around. The absolute lowest level is called catastrophic insurance. These are typically your HDHPs, gamblers who are saving up their money and hoping they never get sick or end up in a car accident. That's about the only thing these plans cover. Emergency services. In America, every health insurance plan, regardless of type or tier, covers emergency services, in or out of network. Though once you're stable, you better get out of that out-of-network hospital or the bill will give you a heart attack, which just repeats the cycle. Catastrophic plans are like only having liability insurance on your car. They only help you in the worst of situations. Otherwise, you're on your own. You also have to be under 30 to get it, which means it doesn't apply to me anymore. I mean, it does apply to me for another 5 years. The 4 main tiers of the Affordable Care Act are bronze, silver, gold, and platinum. The better the metal, the more you pay in monthly premiums, but also the lower your out-of-pocket costs when you actually receive care. The ACA defines these tiers by the average coinsurance for the plan. They call this the actuarial value. For bronze, the actuarial value is 60%. They pay an average of 60% and you pay 40% in coinsurance. In platinum, you pay 10% and they pay 90%. Again, this is the average. For some services, it might be 92%, while others might be 85%. At the end of the year, you might find that you actually paid 11%. The actuarial value is the only real definition for the tiers. Premiums, deductibles, and MOOPs can be all over the place. There's really no way for me to compare a platinum HMO to a silver PPO or a bronze POS, making this another determining factor in your overall healthcare costs. But for the sake of an example, let's just pick one. Gold. The average monthly premium for a gold tier plan is $597 a month for an individual and $1,252 a month for a family. The beauty of family plans is that it usually costs the same whether it's 2 people or 7. If you're getting a gold plan through your employer, they might be paying for part of it. If you got it through the health insurance marketplace, healthcare.gov, you might be getting subsidies to help. But for our purposes, we're just gonna stick with the base cost. So let's say you need those $3,000 stitches. An individual gold plan deductible can range from $1,000 to $5,000, but the average is $1,320. Remember, you pay that much before your insurance even kicks in. The remaining cost is shared between you and the insurance company at a 20-80 split, only costing you an additional $336. The average individual gold plan MOOP is $5,878. So we're not even coming close to stage 3. In the end, those $3,000 stitches only cost you $1,656. Wow, just over half. It's a good thing you had insurance.
You forgot about the...
Yeah, as most people do, I forgot about the premiums. On top of the stitches, you paid $7,164 in premiums, bringing your total healthcare costs for the year to $8,820. Here's the same scenario for the average gold family plan. As I've said, it's impossible to know whether an uninsured person with the same $3,000 injury would fare better financially, but it's possible. And while the person writing the $1,600 check while paying monthly premiums is going to feel a lot more financially secure than the person cutting $3,000, the economic realities of healthcare costs in America don't care about your feelings. Now, I picked gold as an example because it has an actuarial value of 80%. Which is the exact same as Medicare. Medicare is a socialized health insurance program that covers 59.9 million Americans, most of which are over the age of 65. It is the largest single provider of health insurance in America. I briefly covered Medicare and how it's funded in my video on welfare, along with another program for poor people called Medicaid. Medicaid is run at the state level, so while it covers 74 million Americans, they're spread out across 54 different state and territory programs, which all set their own requirements and payouts. A single person in Alabama Alabama must make less than $771 a month to qualify for Medicaid. The average panhandler makes $25 a day begging for money on the corner. If they're out there every day this month, maybe take Halloween off is what I'm trying to say. Medicaid benefits depend on your income level. At the lowest, you're paying single-digit copays, and at the highest, 20% coinsurance, just like Medicare. But while Medicaid is a complicated welfare program, Medicare is not. It's government-subsidized health insurance. Every American who works pays into it with a 1.45% FICA tax, which is also matched by your employer. If you contribute for at least 10 years, you get full Medicare when you turn 65. Medicare is not free. It's also not simple, but since it currently covers 20% of all Americans and presumably will cover all of us once we're old enough, it's worth looking into. I need to start by saying this is just an overview. Most of my audience is several decades away from Medicare, so if you're currently in the process of enrolling, please speak to a professional. This is just an introduction. There are entire channels dedicated to explaining Medicare. We're just going to scratch the surface. Medicare has 4 parts. Part A is for inpatient services like overnight stays at a hospital. For the vast majority of people, there are no premiums for Part A, but there is a $1,364 deductible and a complicated copay and coinsurance table. Medicare Part B is for outpatient services like regular doctor visits. This does have a monthly premium for most people, but before I tell you what it is, remember that you're getting an actuarial value of 80%, $135.50 a month, regardless of who you are. But we've learned that low premiums usually equate to a high $185 deductible. So because stitches are usually an outpatient procedure, we can figure out that those $3,000 stitches would cost you $748 out of pocket and $2,374 a year in total expenses. There are no family plans in Medicare. It's just for the individual retiree. And these are by far the cheapest stitches we've come across so far. But there's a catch. Medicare Part A and Part B, collectively referred to as Original Medicare, have no maximum out-of-pocket limit. You pay the same 20% coinsurance to infinity and beyond, which is why we need to talk about Medicare Supplement plans, also known as Medigap plans. These add a MOOP, as well as reducing your coinsurance. This is an add-on run by a private insurance company that doesn't get to decide what or how much they cover. That's dictated by Medicare. They do get to decide what to charge you though. Alternatively, you can scrap Original Medicare altogether and opt for Part C, better known as Medicare Advantage. This is a private insurance plan that takes the place of Parts A and B, and sometimes D, and acts as its own supplement, so you get a MOOP. You pay your premiums to them rather than Medicare. Now the insurance company gets to make decisions about your healthcare rather than the government. And it is required to give you that same 80% actuarial value. In theory. In practice, the HHS Inspector General recently found that 56% of people on Medicare Advantage were denied necessary treatment simply for monetary gain. I know, right? I was just as shocked as you. About 36% of people on Medicare opt for Medicare Advantage. So when you hear someone complaining about Medicare, there's a decent chance they're not actually on Medicare. And I'll give you one guess as to which part ends up with the most waste, fraud, and abuse. It's actually Part D, which is your optional prescription drug coverage, but before you get mad at me for the bait and switch, both C and D are run by private insurance companies. I'm not kidding, Part C and D waste, fraud, and abuse is rampant. You can find the PowerPoint presentations from HHS online. The problem is that when the news tells you about Medicare waste, they usually leave out which parts are causing that. And when they talk about healthcare statistics, they neglect to mention that 1/3 of the people are actually on private insurance. The 59.9 million number I cited earlier is Original Medicare and Medicare Advantage put together. There are 44 million people on just Original Medicare, and 90% of them don't use Medicare exclusively. They also get a Medigap supplement plan or a Part D prescription plan or both. Prescriptions aren't usually covered by health insurance. Even in countries with universal socialized medicine, dental, vision, and prescriptions are usually separate. And prescription drugs are even more of a mess than healthcare. Each Part D plan has a list of prescriptions they cover called a formulary, and you'll need to look over that list when choosing your plan. I hope you accurately predicted what medicines you'll need in the future. Americans pay the absolute highest prices in the world for medications, sometimes by an order of magnitude. And the main reason is somewhat counterintuitive. The UK has a single-payer system known as the National Health Service, or NHS. Every British citizen is covered for almost no out-of-pocket cost. A total of 66 million people. The government negotiates prices with drug companies knowing that they will be the only provider of that medication to 66 million people. So they get a pretty good deal. There is no equivalent in the US. The government doesn't negotiate or even really regulate prices. The best we have is Medicare with 44 million people. And there's a reason they pay the least. Counter to the common capitalist perception that competition and choice drive down prices, at least when it comes to healthcare, market share seems to have much more influence. The more people you're negotiating on behalf of, the lower your prices. But also, it costs a lot of money to develop treatments and medications, so companies want to make the largest return on investment as they can. But when you're selling to the UK and Germany for such low prices, where are you going to make your money? The country that isn't negotiating on behalf of 320 million people and has little to no regulation regarding price ceilings. Why do they charge so much? Because they can. The common argument against adopting a system like the UK's is that they are incredibly overtaxed. So let's get our calculators back out and check. The median household income in the United States is $59,039. Assuming just the standard deductions for a single person, you would be paying $10,804 in federal taxes, both income and FICA. I have a video all about income taxes if you want to know the actual math behind that. If you took the same income and went to the UK after converting to pounds and then back again, you are paying $14,451 in national taxes. This includes your income tax and the national insurance tax, which is like our Medicare tax but significantly larger. Side by side, if you make the median household income in the US, you are paying 18.3% in federal taxes. If you took that same amount to the UK, you'd be paying 24.5%. But remember, healthcare is included. If you want healthcare in the US, the average annual employer-based premium across all types and levels for an individual is $6,896 a year. So in reality, you're paying 30% of your income in taxes and health insurance, and that's not even considering what happens if you actually get sick. In the interest of being thorough, if you double the median income to $118,078 and were married with 2 kids, you would be paying significantly more taxes in the UK. However, your health insurance expenses don't really change, whereas the average employer-based health insurance premium for a family is over triple that of an individual. So a US family is still paying more in taxes and healthcare, even if they never go to the doctor. The UK does have a value-added tax, or VAT, of 20%, but their cost of living is about 7% lower. Once you consider sales tax in the US, prices are pretty comparable. A Samsung Galaxy S10 costs about $15 more in London than New York, and a Big Mac is $1.50 cheaper. The quality of these products is pretty much the same wherever you go, but for some reason, we insist that US healthcare is the exception. That has to be the last variable on our list. American stitches are just inherently better than UK stitches. No. Most people already know this, but the UK, Canada, Australia, and most other industrialized countries beat us in just about every healthcare metric. Life expectancy, infant mortality, maternal mortality, the list goes on. But generally these numbers are close enough that you can say the US is basically on par with everyone else. But per capita, we are paying double what they are. Objectively, the UK does have longer wait times, from a few minutes in the ER to a week or 2 for a specialist. But I want to challenge your assumptions here. If waiting a little longer drastically reduces cost, but doesn't negatively affect healthcare outcomes, how important is it to be seen right now? Can you zoom in and say that the US is better in a specific field like heart transplants or post-op complications? Sure. but overall, we're not getting what we're paying for. Which is why we've been arguing about how to change things since forever. But we might actually do it this time. I'm obviously not going to talk about all of the proposals because you'll never hear from most of these people ever again. So let's just focus on two. Mayor Pete is proposing a Medicare opt-in plan, or Medicare for all who want it, which is just a reskin of the classic public option. This would open up Medicare to anyone. If you're uninsured, you're automatically on it. If you get health insurance through your employer, you can switch, but otherwise nothing changes. Unless your employer wants to switch to Medicare, in which case you don't have a choice. It would also make a few smaller changes like adding a Medicare MOOP and capping out-of-network costs. Most people wouldn't see any changes to their healthcare, which isn't very exciting, so let's talk about the plan you all want me to, the Medicare for All proposal from Kristen Gillibrand.
She's not even running anymore.
You won't let me just have... Fine, let's talk about Bernie Sanders. Bernie's Medicare for All plan would basically turn our healthcare system into the UK's, with a single-payer government health service, but with dental, vision, and prescriptions included. Like the UK, there would be no premiums and little to no out-of-pocket expenses. It also abolishes private insurance. No more employer-based health insurance, no more healthcare marketplace, no deductibles, no premiums, no channels completely dedicated to demystifying Medicare. You and your doctor will make decisions about your healthcare, not a private corporation. And the government would be the third-party payer. How they would pay for this is always a point of contention, and sometimes the question is intentionally worded poorly.
How much are your taxes going to go up? And you'd said,
how much are your costs going to go down?
No, different question. How much will your taxes go up?
No, it's how much are your costs? Because it's how much.
That sounds like a dodge because she's trying to reframe the question. Taxes will go up. Primarily for the wealthy, but likely for the middle class as well. But remember, even if your taxes went up by 50%, the fact that this expense no longer exists means that you are still better off. And you won't pay much more, if at all, when you need medical care. This would also reduce the overall bloat in our system that contributes to the high cost. Your HR person needs to pick a health plan, hospitals and doctors need to hire special billing coders, insurance companies need claims specialists, and YouTubers need to make videos explaining it all. I'm positive we can do better than this. But if you insist on keeping your healthcare costs unnecessarily high, even under the proposed Medicare for All, might I suggest getting into vitamins and supplements? An industry you can learn all about by going to curiositystream.com/knowingbetter. CuriosityStream is a subscription streaming service that offers over 2,400 documentaries and nonfiction titles from some of the world's best filmmakers that you can access across multiple platforms. Learn all about vitamins and the industry that sprung up around them in this documentary hosted by fellow YouTuber Veritasium. Even though I know most of us don't really need to take vitamins, I can't seem to help myself. You can get access to their entire library for as little as $2.99 a month. But if you head over to curiositystream.com/knowingbetter and use the promo code knowingbetter, you can have the advantage of getting your first month completely free, as well as getting access to Nebula, the new streaming service put together by YouTube creators to have a space to create videos without worrying about algorithms and demonetization. My channel, as well as many of your other favorites, can be found there, including several original series. By joining CuriosityStream and Nebula, you'll also be supporting the channel. Full disclosure, I have no horse in this race. I'm a service-connected disabled combat veteran. I get my health care through the Veterans Affairs Hospital, which is not a health insurance program. It's a self-contained system and a bottomless well of asterisks. So I'm not complaining about this system and talking about proposals for change for my personal benefit. I also had no reason to give myself all that math homework. It took me a month of daily research to figure all this out and present it to you. And that alone should tell you this is overly complicated. Luckily, I don't do anything else with my time. So now, as you're watching debates about taxes or reading articles about rising premiums, you'll actually understand what they're talking about, because now you know better. If you hadn't noticed, I made some improvements to the set, so if you'd like to add your name to the Chargemaster, head on over to patreon.com/knowingbetter, or for a one-time donation, paypal.me/knowingbetter. Don't forget to co-pay that subscribe button, check out the merch at knowingbetter.tv, follow me on Twitter and Facebook, and join us on the subreddit.